Dr. Evan Mladinov coming to you from the Concussionology virtual studios regarding our 4-part masterclass series on concussion diagnosis and treatment for chiropractors. As you know, the laws in many states like Colorado and Pennsylvania for chiropractors diagnosing, treating, and authorizing return to play from a concussion are oppressive and very, very restrictive. This 4-part masterclass beginning in October is directed to how to diagnose and treat concussions. There is CE approval for all 4 classes, and I like to call this, if you shake it, you break it. Now, some of you are probably sitting there saying, I'm not interested in traumatic brain injury or dealing with concussions, but if you have a patient who has been in a car accident and their head moves or hits the windshield or the seat back, they have a concussion. Movement of the head without it hitting anything will produce a concussion. The head doesn't have to hit anything to be concussed. The procedures you're going to learn, you can immediately implement Monday morning to treat patients. These same protocols are equally applicable to your headache patients, your migraine patients, patients with digestive disturbances, a twisted ankle, arthritis, or even your chronic pain patients. All of these techniques and procedures are applicable to all of those conditions. If you're like me, you don't have time for 300 to 1,000 hours of neurology classes that focus on memorizing minuscule little pathways of nerve function, and they never seem to get to how do you fix the darn thing. That is the focus of this 4-part masterclass series. How do you fix your patients starting Monday morning? Now, my patients cannot afford thousands of dollars of blood tests, and your patients may not either. That's not going to be the focus of this program. Blood tests, yes, are important, but that's not going to be the primary focus like other neurology workups recommend. The 4 seminars will cross the boundary of every chiropractic technique because there are times that SOT may be appropriate. There are times where Merrick adjusting may be appropriate. There is time where specific exercises will be important. There is specific time where acupuncture may be the important treatment of choice. And there are target-specific metabolic treatments that must be started for these patients and many other procedures that you may or may not be familiar with. This is going to be a multifaceted approach that is totally applicable for a traditional chiropractic office. This seminar series is the chiropractic advantage because we are ahead of the healthcare minds in terms of concussion care and management. The seminar series will focus on giving you immediate examination and treatment strategies that you can implement Monday morning. Be ahead of the curve for treating your patients with concussions, whether it's ahead of the MDs, PTs, or athletic therapists, or ahead of mandatory training to diagnose and treat concussions, which may be coming to your state. The Concussionology Master Classes are strictly limited to 25 attendees, so join us in Denver, South Florida, or the Lancaster-Harrisburg, Pennsylvania area this October. My mission is to have chiropractic be the treatment of choice for concussions. To get details about the seminar, send a text message the word concuss to 555-888, or you can log on to www.concussionology.us. And by the way, you get 50 CE credit hours for the master classes. So again, to get more information, send a text message the word concuss to 555-888 for more details.